Hi everyone, this is Dr. Terry Messman-Moore, and in this video I'm going to discuss the results of Mary's mental status examination. We'll talk about different aspects of the exam, how we rated those aspects, and discuss what this means for her diagnosis. The first interview focused on Mary in a depressive episode. When we think about a depressive episode, we are going to anticipate that particular behaviors and mood and affect will be present. Nonetheless, we still want to conduct our mental status exam. Starting with levels of consciousness, Mary appears to be drowsy and lethargic. She seems sleepy. She doesn't seem alert, and she doesn't seem wide awake, but she's not asleep. She does not appear to be under the influence of substances. Her appearance is average. She appears well-groomed. She's wearing appropriate clothing. Her attitude is cooperative. Although she's not always talkative, she does appear to engage with the interviewer, attempting to answer his questions. She's not evasive. She's not uncooperative. Her activity is notable. She shows psychomotor retardation, meaning that her body movements are very slowed. There was also evidence of slowed or delayed mentation, meaning that it seems that she's having difficulty thinking clearly and that her thought process is delayed. Connected to this, her speech. Her speech is also somewhat slow, but the key factor here is that she has a very monotone speech. There's very poor variability and little inflection. This is a clue to the next category, talking about affect. Her mood, by her self-report, was dysphoric and apprehensive. Dysphoric is another word for feeling sad or depressed, and apprehensive is another word for feeling anxious or on guard. Her affect was blunted. This is connected to the monotone speech. She had a very blank, slate-like face, almost like a zombie, and her facial expressions or affect did not change throughout the interview. Her affect, however, was non-labile, meaning that it didn't change considerably throughout the interview. She seemed consistently blunted, but also consistently depressed. Her affect was also non-reactive, meaning that she didn't shift in response to certain questions. The affect stayed the same. Now, her affect and mood were at times congruent and at times incongruent. So when she was talking about when her dad was beating her up, she was smiling. That would suggest mood incongruent affect. However, the majority of the interview, she seems sad, although blunted, and her affect is congruent with her mood of dysphoria and apprehension. Last, the range of her affect is restricted. She's not able to display or appear to experience any other type of affect. So she's consistently sad and very down and not able to shift. Remember that affect will shift throughout an interview even if the mood is predominantly sad. So when we're interviewing someone who's depressed, for example, they oftentimes will be able to smile briefly or shift their facial expression momentarily during the interview. We don't see any of this in Mary's depressive episode. Moving on to the next part of the interview, let's focus on thought process, thought content, and perception. So Mary's thought process was notably disorganized. Her thought process evidenced looseness of associations and flight of ideas. For example, Her looseness of associations and tangential thought could be exemplified by the example of when the interviewer asked about the bandage on her hand, and she said, "My husband, I think he plays around on me." She goes on to discuss, or we infer, that she actually burned herself with a cigarette, perhaps because she felt rejected or abandoned by her husband. So there is a connection, but it's very loose. Another example would be the first time she talked about the first time she separated from the devil, from 1985, and 85 was the devil. So she was discussing the course of her illness. This is very loose and very difficult to understand. If you watch the video a few times, you figure out that she's talking about the year 1985, and she's talking about one of the first onsets of her bipolar illness. Going back to thought process, we also want to look at whether her thoughts are logical, which they are not, and whether they're coherent. Again, it was very difficult to follow her thought process. It was somewhat incoherent when talking about the course of her illness. In addition, there was flight of ideas. Flight of ideas, again, is where a person starts thinking along a train of thought and it takes them towards another idea away from what they initially intended. So in response to the question, "How are you feeling today?" she starts reporting that she's on top of the world. And then she starts to shift into song lyrics. She says, "I'm on top of the world, looking down on creation, and the only explanation I can find." So maybe you're a little too young to know this song, but this was a song in the 70s. And so what is happening is she's starting to report her mood, being on top of the world, which, by the way, is incongruent with her affect. And she goes on to talk about song lyrics. This is a classic example of flight of ideas. Okay, moving on to thought content. Her thought content broached several areas. All of them were negative in connotation. So she was paranoid, feeling that others were out to get her or judging her. She also expressed some suicidal ideation and concern of wanting to kill herself. There was some psychotic distortions, feeling possessed, both by good and evil, and she often talked about feeling possessed by the devil. She said she felt that she was being judged, that by the devil all the time, and that people were out to get her. These are all paranoid and psychotic distortions and delusions. However, these are congruent with her mood, meaning that when people are depressed, they typically have negative beliefs and delusions. So again, the delusions are persecutory, but there's also some delusions of grandiosity. So this delusion of grandiosity is mood incongruent because we don't expect grandiose delusions during a depressive episode. The example of the grandiose delusion is that she has a special relationship with Jesus Christ. Next, we look at perception. There is evidence in this interview of maladaptive perceptions in the case of hallucinations. So she talks about auditory hallucinations, voices telling her to kill the devil, and this also is connected to hearing other voices. It's not clear if she's having visual hallucinations or not. She talks about the devil on her shoulder and brushing him off. It may be that she actually sees an image of a creature or some being that is the devil, or it may be that she's talking about it figuratively. If this was our interview, we might pursue this further. Her cognition was also impaired. One of the things that was clear was that her attention or ability to sustain attention was very poor. She was easily distracted. At one point, she lost focus when talking about Jesus Christ. She actually paused, and the interviewer had to intervene and ask how she was doing. So, cognition can be orientation to person, place, or time, but also concentration, and attention is important to note. We also want to look into insight. Does our patient understand the extent of their illness, how it's impacting them, and the consequences it's having in their life? Mary does admit that she has an illness and a diagnosis of bipolar disorder, and she talks about its impact. Yet she seems to have really poor insight into whether this is really affecting her life. She talks about when she takes her medicine, she doesn't hear voices, and they talk about flare-ups, which would be the episodes of the bipolar disorder course. She reported feeling normal when her mood was on medicine. However, she still seems to think that she is currently on top of the world, which is not congruent with her depression. So she seems to have poor insight into her current episode and state. Finally, we look at judgment. Judgment can be reflected in a person's ability to make particular decisions, but is also connected to one's behavior. There are numerous examples in this interview of Mary's poor judgment. She's engaged in impulsive behavior and was aggressive with another patient on the unit. Mary also harmed herself with a cigarette by burning her hand. So when we talk about judgment, we're talking about both the ability to make decisions and one's ability to inhibit or engage in appropriate behavior. Let's move on to the manic episode. In the manic episode, we see Mary in an entirely different state. And what's interesting is our ability to watch these videos and see her in both states fairly close together in time. During the manic episode interview, Mary's level of consciousness is hyper-aroused. She's awake and alert, but she's almost on edge. She's almost too aroused. Her appearance, again, is average. She's dressed appropriately, she appears to be groomed, and she's wearing appropriate clothing for the season. Her attitude is cooperative, as it was before, but in this interview, she's noticeably more open and friendly. She wants to talk and she wants to engage with the interviewer, more so than during the depressive episode. Her activity level is also notable. In this interview, she's agitated and fidgety. She's moving around a lot, looking at the camera, and asking the cameraman whether she's in focus. So she's moving more than we would expect, and we would call this psychomotor agitation. Her speech is also notable. During this episode, we can see that her rate of speech is pressured, and this is a marked difference from the other interview where she was depressed. At one point, she says, "Can I just talk?" to the interviewer. So she's got a lot of ideas in her mind, and she wants to share them. However, her speech is still articulate, and it's variable and appropriate, meaning that her speech is not monotone, but has prosody as we would expect. Mary's mood would be labeled as euphoric. She reports feeling high and really good. She gets very silly in the interview. She starts laughing uncontrollably, sometimes inappropriately so. Euphoric would be one of the words that we would use or descriptions we would use for a manic episode. But not all people in mania feel euphoric. Some people are highly irritable. Mary's affect was heightened. This means that her affect was very extreme, more so than we would expect in the average person. It was also labile. It shifted back and forth throughout the interview, but was reactive, meaning that she shifted according to the topics at hand. There were times when her mood and affect were congruent, and this happened most of the time. But there were also notable times when her mood and affect was incongruent. This tended to be focused on the time when she was talking about her mother's death and was laughing even though she reported feeling sad. Even though Mary has heightened affect, I would still describe her range of affect as restricted because she's not able to express sadness or dysphoria, even though she's reporting that when talking about her mother's death. Mary's cognition is also poor in this video. She has a lot of problems paying attention. She's very easily distracted. Again, asking the cameraman whether she's still in focus is highly distracting and really inappropriate behavior. This suggests that Mary has a lot of thoughts going on in her mind and she's having trouble tracking them and paying attention to the task at hand. Her insight is also very poor and limited. However, she thinks that she's doing okay. When the interviewer asks her how she would do outside of the hospital, she doesn't perceive that she would have any limitations. However, it's very clear that she would probably get in trouble if she was outside the hospital, given her poor behavior. This is related to her judgment. Again, I would rate her judgment as poor. She's engaged in impulsive behavior and aggressive behavior by beating up her husband as he visited her on the unit. So she's on restrictions, which she mentioned, meaning that she had engaged in behavior that affected her freedoms on the unit. In terms of her thought process, we see that she has loose associations, ideas of reference, and flight of ideas. So all of these are present. Looseness of associations, again, is kind of the general disconnection of thoughts. But what we see here are very extreme looseness of association. When she states to the interviewer that she is a spy, he asks, "What's your mission?" She pauses and says, "Fight for the American way." And he queries, "Something more?" And she says, "The Statue of Liberty." This is very, very disconnected thinking. Although we might be able to, in hindsight, put some meaning to it, on the surface, the thoughts don't flow together and they're not logical or coherent. Her thought content focuses mostly on delusions of grandeur. These would be mood-congruent delusions. So we would expect that delusions during a manic phase would be grandiose, whereas we would expect delusions during a depressive phase to be sad, depressed, or negative. So some examples of the delusions of grandeur are her beliefs that she can control the weather and that she can be a spy for the government and for God. In terms of perceptions, it's unclear in this interview, in my opinion, whether Mary is experiencing hallucinations. The interviewer asks about her experiences with hearing voices, but what she describes to me might actually be just heightened perception and awareness as she's awake at night or can hear people around her on the unit. If I was the interviewer, I would want to query more to determine whether she is actually experiencing auditory hallucinations or not. So thinking about this interview, there's some other things that I want to mention before moving on. First of all, she talks a lot about some themes. So there's themes that are evident, such as having power and control over the weather and being important, for example, being a spy. She talks about that she feels that she can get drunk on coffee or water, but she specifies this is only during what we would call the manic phase or when she feels high. These are all symptoms of bipolar disorder. And though the mental status exam isn't designed to assess particular disorders, what it can do is reveal symptoms that are critically important to a diagnosis. In the case of bipolar disorder, during mania, we typically see very grandiose delusions. Another example of the flight of ideas and ideas of reference and loose associations is her discussion of her mother and her mother's death. She reported that her mother died at the age of the year I was born, at 61. She thought that her mother's age, the dates she died, etc., had special meaning. These are ideas of reference. She's making assumptions that this was a predetermined event based on the numbers in her birth date and her mother's death date. In addition, we also see, again, inappropriate affect, the laughing inappropriately while talking about her mother, giggling in a way that she can't control. So this interview, I think, is a really good example of someone in the height of a manic episode. and suggests that she has both the symptoms of mania as well as depression, so meeting criteria for bipolar disorder, but also showing very impaired judgment and insight into her illness. So this is the end of the wrap-up video. I hope that this was helpful for you to learn more about how we make judgments and connecting the labels of the mental status exam with the patient's behavior. Thanks for listening.